Yeah, hello everyone. It's me, myself, and I, your favorite Eko Pharmacist, and you're welcome to the novel, the ingenious, the innovative, and the first episode of Chronicles of an Eko Pharmacist. Yeah, we are here finally. It's been a challenging process, but thank God we are finally here. And today we are here to talk about a particular drug that we all know. It's called aspirin. But before we proceed, I want you to kindly go down, click on the subscribe button, share the link, invite your friends to watch this video, to learn and to subscribe. And also don't forget to drop your comments and questions in the comment section. So now back to aspirin. Yeah, so aspirin is also known as acetyl salicylic acid. Acetyl salicylic acid, yes, aspirin is an acid. I'm very sure most of us never knew aspirin was an acid. But yes, aspirin is an acid. So, and it's also known as ASA. You see in some prescriptions or some, journals and the likes written as ASA. So aspirin is also known as ASA. Aspirin is an anti-inflammatory drug, an antipyretic drug, and is also used for pain. Invariably, what I'm saying is this: aspirin takes care or treats inflammation, it treats fever, and it also treats pain. It's used in conditions such as painful menstruation, known as dysmenorrhea, and also mild to moderate pain. It's also used in cases like rheumatoid arthritis that are common in elderly people because these conditions are caused by inflammation, and aspirin takes care of inflammation. Now, what is aspirin? How does it work? Aspirin elicits its effects by blocking the synthesis of what we know as cyclooxygenase enzyme, but it's popularly known as COX. Now, there are several types of COX, but the ones that aspirin acts on is COX-1 and COX-2, that is cyclooxygenase 1 and cyclooxygenase 2. Aspirin inhibits the synthesis of this enzyme, and these enzymes are actually responsible for the production of prostaglandin and thromboxane. Prostaglandin is responsible for the secretion of mucor in your GIT, that is the mucor that protects our stomach from gastric acid. And also, prostaglandin is responsible for pain, fever, and allied condition. Prostaglandin is also responsible, for several other processes in the body, while thromboxane is responsible for blood clot formation, that's platelet formation, which are responsible for the clot of blood. That's what brings about your blood becoming thick when you have a cut or when you're bleeding, basically. So that is what aspirin inhibits. Now, what is the relevance of this process in the use of aspirin? I would explain that. Now, because aspirin blocks thromboxane secretion, it has found use in patients with cardiovascular conditions such as myocardial infarction. How? Thromboxane being inhibited prevents the blood from coagulating, which enables a freer flow of blood, which means your blood do not coagulate. And this is actually needed in the prevention of myocardial infarction in patients with cardiovascular conditions. That is why you will see vasopressin in grandma's medication or daddy or mommy's medication, because a low dose administration of aspirin, to patients help in thinning the blood. So they are generally called blood thinner. So when next daddy says, Biodun, come and buy me vasopressin, you already know the reason why vasopressin is part of his medication. Now, back to the pain part of aspirin. Now, aspirin prevents pain by inhibiting these enzymes, like I've said. You understand? But then it also has one side effect or a few side effects, but this particular one is what I would emphasize on, and that is because of its inhibition of COX-1. Its inhibition of cyclooxygenase enzyme, rather. Now, when this inhibition occurs, it inhibits prostaglandin. And don't forget, I already mentioned that prostaglandin is responsible for the secretion of mucus that protects our GIT, that protects our stomach from gastric acid. Now, when this prostaglandin is inhibited, mucus is not secreted. Our gastric tract, our stomach, is exposed to this acid, and this acid causes what we know as ulcer. So when they tell you Patients that have ulcer cannot use aspirin. This is the reason why they cannot use aspirin. So let's fast forward to the dosage of aspirin. Aspirin is used, like I said before, in mild to moderate pain. And the dose for mild to moderate pain of aspirin is between 300 to 900 milligrams and a maximum dose of 4 grams daily. Please note that the gap between a particular dose and the next is a minimum of 4 to 6 hours. So if you take, let's say you take 900 milligrams by 9 a.m., you should not take another dose until maybe 2 or 3 p.m. I think that makes sense. Yes. So, and also for treatment of rheumatoid arthritis, a dose of 600 to 900 milligrams, in a period, in a divided dose of 4 times in a day is required. Also note that aspirin is not to be used in children, especially children under the age of 16 years. Why? Because aspirin causes what we call Reye's syndrome in children. Reye's syndrome. Reye's syndrome is a disease, that affects children below the age of 16 when they use aspirin. That is why aspirin is contraindicated in children below the age of 16. Now, let's move to the overdose of aspirin. Overdose of aspirin, also known as aspirin toxicity or salicylism or aspirin poisoning or salicylate poisoning. You understand? It occurs when you use too much aspirin. Too much aspirin in the sense that you use more than 900 milligrams per single dose, or you exceed the 400 grams daily dose of aspirin, or you decide to use 900 milligrams now and decide to use another 900 milligrams in the next 1 hour or 2 hours or 3 hours. Now that is an overdose of aspirin. Now, what does overdose of aspirin cause? Overdose of aspirin overdose of aspirin is, all right, so that is what happens when you overdose on aspirin. It is known as aspirin poisoning. Now, what are the major symptoms you will notice when one has been overdosed on aspirin? 1, GI bleeding. Apparently, you will see that your stool becomes bloody. You notice abdominal pain, nausea, vomiting, increase in body temperature, increase in heart rate. You understand? You notice a low blood pressure and bleeding. These are major indications of overdose of aspirin. Mind you, aspirin overdose has no antidote, but it can be successfully managed if such patient is rushed to the hospital on time. Now, how do they handle it in the hospital? 2 major methods. 1, you use the method called GI decontamination. What's GI decontamination? Basically, it is decontamination of your gastrointestinal tract using activated charcoal. Another thing they do is alkalinization using sodium bicarbonate. These are things you can't do at home. These are things that can only be done in the hospital, which is the reason why such patients should be rushed to the hospital. That being said, aspirin is contraindicated, which means it cannot be used in patients or people that are pregnant, that are breastfeeding, because these drugs get secreted in breast milk. And remember, I told you it is not safe in children. It can also cross the placenta, and I told you it is not safe in children. That means it can actually go and affect the child in the, the fetus in the belly, basically. So avoid aspirin use in pregnant women, in breastfeeding mothers, in people with bleeding disorder such as hemophilia, and also in patients with GI disorder or peptic ulcer. Also note that strict adherence to your pharmacist's counseling on drugs and your doctor's prescription is maximally required. Don't forget, pharmaceutical companies do not write keep all drugs out of the reach of children for fun. So enable you keep all drugs out of the reach of children. Consult your pharmacist for all drug advice and ensure that you adhere strictly to them. Thank you for watching this episode of Chronicles of an Eko Pharmacist. We hope to see you in our next episode. Take care and stay blessed.